to answer this, I think we need to think about who is the patient with multiple sclerosis in the United States today. The average patient with MS is a person in her or his early 50s. So very often when we think about an MS patient, we think of somebody much younger, but at this point in the United States, the average age of a patient with multiple sclerosis is in the early 50s. That means that there are patients that are significantly older than that, and obviously patients, particularly newly diagnosed patients, that are younger. Naturally, conditions that affect young individuals may not be the same in conditions that affect the middle age or the older patients. But as we age, obviously comorbid conditions become important. Diabetes, hypertension, perhaps also consideration of how our immune system actually works, very often in the field referred to as immunosenescence, is becoming important. With that, it is for the practitioner obviously very important to think about who is the patient that we are treating. Is this a young patient at an age where inflammation can really be very active? Is this an older patient where we are very significantly concerned about progression of the condition? And how do the other conditions potentially impact with what we are doing? Here it's important to keep in mind how long has the patient been on an agent? Is there potentially, are there potential consequences from continued immunosuppression in patients? There are certain medications that may potentially lead to shedding of protein from the urine. Obviously, in a patient with diabetes, where protein in the urine will potentially indicate injury to the kidneys. That's something that one needs to balance against each other, because starting a patient on such an agent may potentially blind the practitioner to consequences of the diabetes. With hypertension, we need to think about patients, whether or not the agents that we choose with multiple sclerosis may potentially drive up the blood pressure, and whether or not the patient is well controlled. We have certain medications in multiple sclerosis for the treatment of multiple sclerosis that may affect the heart rate. Here it's very important to note what the patients are on with respect to the treatment of the cardiac conditions, the cardiovascular conditions, when these were introduced. So for some of these agents, obviously one doesn't want to start these specific classes of MS medications into a patient that just experienced changes of blood pressure medication. It's also important to keep in mind that MS and other autoimmune diseases sometimes come in pairs. So a person may have rheumatoid arthritis and multiple sclerosis, or may have other autoimmune conditions. With the fact that we have now more treatments that are specific for autoimmune conditions, there come also questions of bringing together medications that potentially would be exclusionary. I'll give you an example. Some of the medications used for rheumatoid arthritis may not be indicated or may actually put patients with multiple sclerosis at risk. And so a patient with multiple sclerosis and rheumatoid arthritis may have to go on certain medications in order not to essentially rev up one autoimmune condition while controlling the other autoimmune condition. So as we think of the MS population, we need to think of comorbid conditions that can be age-related or come with age. But we also need to think of comorbid conditions that are driven by the fact that an MS patient or a patient with an autoimmune disease in general has a higher likelihood of having presentations of a second autoimmune condition. If we move to the lower end of the age spectrum in multiple sclerosis, obviously there are other quote-unquote conditions come into play, meaning pregnancy in consideration, family planning, which again is very important because when we think about MS, 2/3 of newly diagnosed patients are women, and it's obviously the vision, the dream of many to have a family. And so we need to marry the needs for control of multiple sclerosis with the needs for somebody to safely go through pregnancy and reduce the risk for the offspring of such a pregnancy.